When President Obama declared H1N1 a national emergency in late October, it gave us a better sense of just how much of an impact this new strain of flu could have. Thousands of Americans have been standing in long lines for the vaccination, while even more have been turned away due to shortages. Now, those are shortfalls that have also impacted the production of seasonal flu vaccine. Joining me now from outside our state health department is our Betty L. Michaels.
Well, Rob, on average, 36,000 people a year die from the flu. And with the increase of the H1N1 virus causing a shortage of flu vaccine, that number could increase. It's that time of year again. But this year's flu season carries the added inconvenience of having to actually hunt down the shot.
Did it hurt? No.
That's because the seasonal influenza vaccine has gotten some pretty stiff competition from H1N1. Dr. Christy Bradley is the state's epidemiologist.
The companies had to divert some of their production capabilities to produce the H1N1 vaccine at the sacrifice of some of their supply of the seasonal flu vaccine.
The latest casualty in the flu vaccine shortage, Stillwater Medical Center's annual flu shot drive-through. A big hit in years past, but not this fall. Shyla Eggers is with the medical center.
Our foundation spends all year raising money to purchase the vaccinations. And so, of course, we're very disappointed when we're unable to get our order from the supplier and are not able to put on our event this year like we have done in the past.
So what will this mean for the residents of Stillwater? Pam Dvorak, Payne County's nurse manager, says she's fielded many calls asking that same question.
All total, in any given flu year, combined with the drive-through and what we offer for adults through this building, about 9,000 to 10,000 injections get given. And so you just take out the 6,000 that Stillwater Medical Center supplies, and so that reduces it to a third or less that is available for the community. And that in itself makes people concerned and scared.
But the good news, Pam says, is the seasonal influenza virus isn't very active right now. Generally, the flu season peaks in late December through March, and by then she expects to have enough flu vaccine for anyone who wants it.
We're told that more seasonal vaccine will become available in increments, whether that's through a county health department or through a private provider of some sort, like a physician's office or other clinics that are being offered. People should just watch the newspaper and try to seek out a seasonal vaccine.
But the scene at this health clinic is a far cry from the medical center's drive-through, which in the past served 6,500 people in just 12 hours.
Being able to do 6,500 shots in a 12-hour period, it just is a huge jump start on keeping our community healthy. In the past years where flu has been, and when we're talking about seasonal influenza, has been high in other communities, our community has always remained low. So we know it's making an impact in our community as far as the number of visits to the emergency room and the number of hospitalizations.
So while flu vaccines are in short supply nationwide, the federal government has ramped up its release of H1N1 vaccines to states, with Oklahoma receiving almost 280,000 from late October to early November.
This is very important to protect Oklahomans, and as the vaccine becomes more available, we certainly urge persons to seek this out and get vaccinated. Right now, we especially want children and pregnant women and parents of infants under 6 months of age and adults with chronic medical conditions such as diabetes or conditions that affect the lungs or the heart or suppress the immune system to be more at the head of the line in getting the vaccine now.
Rob, healthcare providers do want the public to keep in mind that the flu season is still relatively early, so getting your flu vaccine late is still better than not getting it at all.
So what's going to happen in Stillwater with their drive-through program?
Well, the foundation is collecting money, and they do hope to be back next year to continue with Stillwater's drive-through tradition.
All right. Thank you a lot, Betty L. Now, interestingly, the elderly are not considered at risk from the spread of H1N1 as other people are. That's because in their lifetime, they've been exposed to similar strains of the flu and have built up a resistance. Now, if you'd like to see the complete list of who should be immunized, go to our value added section on our website where we have a link to the state health department's list.